Good afternoon, everyone. Welcome to today's edition of Healthier You here at Oswego Health. Thank you so much for joining me today. As you know, we've been doing these Healthier You series throughout the last couple of years, and we're glad that you were able to join us. Today, we get to talk about springtime and all of those wonderful things that could happen with our allergies, perhaps during springtime. As a reminder, I'm Katie Peglaroli, the Vice President of Clinical Services and Integrated Healthcare here at Oswego Health, and I'm joined today by some repeat visitors, which I'm very happy to bring back to you today, Dr. Nick Groch and Dr. Melanie Groch from Lakeshore ENT, and a brand new visitor with me today, Sami Blais. She is a physician assistant at OFP, and we're so glad that you could all join us as we talk about springtime, which I hope you are as anxious as I am to get to actual springtime, as we've had this crazy weather. All right, thank you. I'm going to jump right in. Dr. Nicholas Groch, I'm going to you first. The weather right now, as I just said, was kind of cold, wet, rainy, hasn't been the warmest spring. And now we're starting to see some of that sunshine and a little bit nicer weather. How can we tell during this change of seasons if we are having sinus symptoms or perhaps something else going on, allergies?
Well, first of all, thank you for having me back on Healthier You. Happy to be here. It is a challenge. That's an excellent question. I'll focus a little bit more on how you know you have an infection, and those symptoms are consistent with facial pain or pressure, yellow, green, or thick white nasal drainage as opposed to just the clear drainage, which is more likely to be an allergy. Lethargy. The patients usually feel sicker when they have an infection than they do with allergies. Sometimes you may have a fever, maybe not. And one thing that's real important is that those symptoms last more than 10 days. So if those symptoms are just a few days of stuffy congestion and whatnot, you can try some Advil or Tylenol and hopefully that'll resolve on its own. But if it persists, you certainly want to see your healthcare provider, preferably Lakeshore ENT, of course, at your earliest convenience. The allergy symptoms that you wanted me to contrast that with are more likely to be stuffy, runny, sneezy nose, or runny nose, sneezing, the clear drainage, as I mentioned. Those patients don't usually have a fever. It definitely can be a challenge, but those are usually the deciding factors.
Great, thank you. I think those are key differentiators for people to say, hey, what's going on here? Certainly see your provider. Dr. Melanie Groch, for you, I think it is allergies. What are some good best practices for allergy relief?
Yeah, that's a great question as well. So when it comes down to treating allergies, really there's three different ways you can do it. It comes down to either avoiding the allergen itself, blocking the allergen from taking effect in your body, or curing the allergy. So starting back with avoidance, the things that you can do for that is, number one, if it's a really high pollen count day, don't go outside, keep your windows closed, stay home. That's not much fun though. So there's other things you can do, and you can, indoors, you can have an air purifier or a filter on your heating and cooling system. If you do go outside and say mow the grass, wear a mask. You can really block a lot of allergens that way. Also, even if you wear, say sunglasses, because that will keep the allergens from coming in contact with your eyes. Another thing that you can do is use nasal saline spray after you've had contact with allergens, just to rinse it out of your nose so that you don't continue to react to it long after. Moving on to blocking, these are where your medications come in. There's some great over-the-counter options like your non-sedating antihistamines, Claritin, Zyrtec, Allegra. Those are great options for people. Another nice over-the-counter option, but you have to be a little more consistent with it, is the nasal steroid sprays. Your Flonase OTC, your Nasonex, those work excellent, and they block multiple inflammatory chemicals that your body releases in response to that allergen. Certainly, you can also come to Lakeshore ENT and get medical treatment as well in the form of prescription strength nasal sprays and pills. Or another option is to get allergy tested, find out what you're allergic to, and go for a cure. And that's with allergy shots. by giving you what you're allergic to in a really small dose that doesn't trigger your immune system response, and slowly sneaking that dose up over time, over the course of 4 to 5 years, you can basically eventually be around a full dose of that allergen without reacting to it, because you've retrained your immune system that these substances aren't going to harm you. So we have lots of options to control your allergies. You don't need to suffer, just come see us.
Great. I think that's really good information, and I definitely learned things today. So if you see me out mowing with sunglasses and a mask, no judging, because I am
Never.
blocking some of those allergens. I do like that.
Absolutely, Katie.
Yes. All right, Sami, next to you. Welcome, first of all, to the Oswego Health family. We're very happy to have you here. And one of the things we heard about is certainly go to Lakeshore ENT, and we welcome you to do that. But how can your primary care provider be involved throughout as you're experiencing some springtime allergies?
Yeah, so first of all, I wanted to say, I'm really glad to be a part of the Oswego Health family and, provide primary care to the community here. Reasons it's important to see our primary care provider not only in the spring, but throughout all the year is, we're able to, offer early detection and treatment of diseases. We can provide chronic disease management and, manage acute illnesses as well. We can also, provide preventative screenings and preventative care. We're able to answer any questions, a patient may have about their health, if they have any concerns. So overall, it's just a good idea if you haven't seen your primary care provider in a while to call, make an appointment, just for, get your yearly physical and just follow up on any health conditions or concerns you may have. And, overall, you'll have more positive health outcomes, and also, the community will be more healthy.
That's great. Thank you. We covered infection and allergies. Are there any other things that are more common in the spring that you see as illnesses?
Yeah, so recently we've seen really like a upspike already as the warmer weather is starting in tick bites, and ticks outside. So, it's really important when you come inside after being out in the woods or long grass, you really make sure you check yourself for ticks, check your pets as well if you have them. And, use insect repellent when you're going outside. We have a high prevalence here of Lyme disease and other tick-borne illnesses. So it's important to check yourself for ticks. And, if you find a tick on yourself, to contact your primary care provider. And then also along with that, with kind of being outside, people who have allergens to poison ivy, we've seen a lot of that, as well as the weather's getting warmer. So, if you have a outbreak to that, it's important to reach out to your primary care to get treated for that. And then, besides the sinus and allergy stuff, we're still seeing COVID in the community as well. So it's important to wear your mask, test at home if you have symptoms, and, get vaccinated and boosted if you're eligible. And then this spring also, we've seen, an uptick in flu cases. So just important to watch out for symptoms. And if it's negative for COVID, contact your primary care and get evaluated.
That's great. Thank you. I know there's multiple people who seem to have those illnesses going around, and someday we will be through talking so much about COVID, but I think it's an important point that there's other things going around. So don't make a guess. Go ahead and make sure that you see someone and get your symptoms evaluated. Thank you. All right, this week we did have a question from the community. Dr. Melanie Groch, I'm going to you with this one.
Okay.
The question is, what is the best SPF to use to protect your skin from the sun?
Excellent question. Sunblock is very important, and many people do not use it appropriately. There's a couple of factors that should be involved in the use of sun protection. A zinc-based product is usually best. Apply it 20 to 30 minutes before you go out. That's one common mistake. People don't apply it early enough. They get outside, they start sweating, and they lose a lot of it. The SPF factor, 50 is about where we see most studies show that above that provides minimal benefit. If you're more comfortable with 75, you can go ahead and use that. It's just probably not going to provide you that much benefit. More importantly is to reapply every 2 hours. If you reapply 50 and above, and if you reapply every 2 hours, you should be just fine. If you're in activity, you're running, you're playing sports, or you're swimming, you might want to reapply a little sooner after you dry off from swimming. Reapply, even if it's only been an hour or a half hour. It's probably a good idea, but 50 is about what to look for as far as SPF is concerned.
Thank you. So we'll
Mhm.
get our sunblock on, get ready for the sunshine.
Mhm.
It's definitely coming. All right. I don't think we have any additional questions at this time from our audience. So I wanted to say thank you. I hope that we have answered some of your questions. Feel free to rewatch this Healthier You when you have questions about your seasonal allergies. I want to thank my panel for being with me today. We're going to be back at you next month with a series on mental health, and that's something that we want to talk with you about. So we hope that you'll join us then, and we hope that you have a great rest of your day. Thank you.
Thank you.
Thank you.
Thanks.